Narika talk show. Let's learn together and grow. And today it is a moment of extreme pleasure to welcome a very acclaimed doctor, Dr. Deepak Ugra, who is present here with us, and he will be answering some of our questions regarding today's topic, which is what to do if your child has recurrent cough and breathlessness. So before jumping to the questions directly, doctor, please tell our viewers something about yourself.
Hello everybody, I'm Dr. Deepak Ugra. I'm the consultant pediatrician at two hospitals in Mumbai Western suburb. One is Leelavati Hospital Research Center and second is Hinduja Hospital Khar. I've been in practice for last 33 years and have an opportunity to deal with various ailments of children over a period of more than 3 decades. And I'm very thankful to Narika and to Indian Academy of Pediatrics current office bearer to think of this very useful idea of dissemination of knowledge about child health. Thank you.
Thank you, doctor. So moving on to our next question, doctor, our viewers would like to know that at what moment would you like to say that you become a doctor?
Okay, so maybe something different from the majority of the people. I honestly never wanted to become a doctor, and it was just a coincidence that when I was supposed to choose my subject, my form was filled up by my father, and who said that I think biology is a better subject for you, and thereafter I continued with the same branch later on, went through the entry exams, MBBS, and then the post-graduation in pediatrics.
All right, doctor. And moving on to our next question. So as the topic itself says, what to do if your child has recurrent cough and breathlessness. So our very first question regarding this topic is, doctor, what is cough and what is recurrent cough?
Okay, now cough is a reflex, and if anything goes wrong in the respiratory tract or the windpipe of any human being, being a child or an adult, the body reacts and it tries to clear whatever has entered our airway, whether it's secretion, it's a foreign body, or anything. It can be infectious agent like viral, like bacteria, and whenever anything triggers the receptor, the body reacts and the child coughs. Having understood this point, that cough is a reflex, we should always try not to suppress the cough when it's mild, when it's not disturbing the child, and let the child's body itself take care of whatever wrong is happening in the air.
Yes, doctor.
As far as recurrence is concerned, I strongly feel that anything that is given in numbers in the pediatrics or in medicine should never be followed to the core. So any cough where the child is brought to the outdoor patient department or even indoor department in a hospital multiple times, and the parents have a concern that my child is falling ill very often, he is getting cold and cough very often, that to me is recurrent cough, provided is affecting the daily life of the child.
Doctor, what to do if your child has recurrent cough or breathlessness?
Okay, now if a child has recurrent cough or breathlessness, the child must see a doctor. As a parent, for the first time when you realize that your child is having cough very often, please visit a pediatrician or a family physician. Let him assess the child. Let him advise investigations if he feels so. Once the diagnosis is made and you are given a prescription, later on, once in a while, if the cough is not very bad, you can give one of those medicines which were prescribed by our doctor in the previous visit. But initially, whenever you feel that a child is falling sick very often with cold and cough, please visit the pediatrician or a family physician.
Okay, doctor. And doctor, what are the common causes of recurrent cough or breathlessness in children?
I've just spoken about some of the reasons for recurrent cough in children. Those are the causes. So, if a child is less than 1 year old, we look at a possibility of reflux where some of the milk is coming up in the windpipe from the food pipe and it's causing cough. Maybe the child has some defect in the windpipe or the food pipe which is causing some of the milk going into the windpipe and causing cough. Maybe recurrent viral infection, maybe some heart disease which is causing more flow of the blood towards the lung and is causing the cough, or it may be some immunodeficiency conditions or some structural problem in the lung which is causing the cough.
And doctor, do premature babies have more chances of getting recurrent cough?
Yes, I've just mentioned that the premature baby, nowadays what is happening is because of the better newborn care setups, multiple, in even the grade 2 cities, more and more small babies are surviving and surviving comparatively much healthier than what used to happen 1 or 2 decades earlier. So these babies do have narrow windpipe and they fall sick very often. In the first few months or even a year or two, they do get recurrent cough. And each and every episode of cough should be treated conservatively with just supporting as far as possible unless the child is really in trouble. And these children for these conditions rarely need any hospitalization.
Yes, doctor. And doctor, do causes of recurrent cough vary with the age?
Yes, some of the causes I just mentioned, like a small newborn and infants, where we look at possibility of a baby being born premature and having narrow airway, to recurrent virus, to the reflux of the milk into the windpipe, to the cardiac or the heart problems. A little older children, toddlers, may have recurrent viral infection or something called as hyperreactive airway, where virus itself can be a trigger or some other allergen may be a trigger. These children also visit outdoor patient department very often with cough and cold. Same age group or a little older may have recurrent cough as a manifestation of childhood asthma. We should remember that unlike adults, where most of the asthmatics present with breathlessness, the commonest presentation of asthma in children is recurrent cough and not the breathlessness. Breathlessness affects only those children who have severe chronic asthma.
And doctor, what does it mean if a child coughs after eating?
So, as I said initially, that the diagnosis or a clue towards the diagnosis or a clue to the pediatrician towards investigation we get from the history given by the parents. So, if the child has episodes of cough after feeding, this points towards a possibility of the reflux that the milk and small babies, the infants, are affected more often. So the milk which is coming from the stomach into the food pipe to the windpipe is triggering the cough.
And doctor, can recurrent cough be asthma?
Yes, not very easy to differentiate every time, but if I have a child, little older, not in the first 1 or 2 years, little older, who is visiting outdoor patient department with the cough very often, may or may not be associated with cold. but usually not associated with fever. And if the parents are giving me a history of a possible allergy to some food stuff, or maybe some air pollutant, smoke, dust, if this child also gives me a history of allergy, example, getting big rashes after a small mosquito bite, or some other skin rashes with some detergent, some toiletries, soap, or some oil. In addition, if there is any other family member who is having a history of allergy or asthma, these are the pointers towards a possibility of asthma in the child who is presenting to the OPD with recurrent cough.
And doctor, what type of exposure triggers the cough?
So triggers may be many. It can be around us, or at times it can be within us. So when a child is coming with a recurrent cough, a pediatrician or a physician must keep the mind open. The things around us which can easily trigger a cough are dust, smoke, house dust mite, any strong smell, maybe pollen, depends on different children. And the trigger within the child may be what we have discussed, like reflux in smaller children, sometime upper airway infection or upper airway allergy, like allergic rhinitis, like adenoids, like sinusitis in older children, can also trigger cough in allergic children or in those children who have underlying asthma.
It's time for a short break now. We will all see you in next few minutes. Welcome back to Narika Talk Show again. Moving on to our next question. And doctor, what can parents do at home to alleviate their child's symptoms?
So, if we are considering cough as the main symptom of the child who is suffering and visiting a clinic, let me say that mild cough should never be suppressed. Now, having said that, if the child is coughing very badly, if his feeding is affected because of cough, if his sleep is affected by the cough, then we should definitely try and treat. There are different medicines in the market, and there are cough suppressant, there are decongestant, there are anti-allergic, and there are bronchodilators. For parents, it is difficult to understand which medicine is for which kind of cough. It is also difficult for them at times to understand whether the cough is initiated from the chest, or is initiated from the throat, or is initiated from the nose. Depending on the site of the major problem, depending on the site of initiation of the cough, the medicine is decided. Having said that, we also need to understand that a child younger than 6 years cannot expectorate. So, expectorant will not have any role in any cough in children below 6 years of age. Similarly, children less than 2 years should not be given cough suppressant. In fact, even at times bigger children also, if we don't give cough suppressant, is a better option. The reason is, as right in the beginning I said, the cough is a reflex which is trying to help the child to eliminate the foreign body, to eliminate the bug, to eliminate those secretions which are collected in the windpipe. So let the choice of the cough syrup be with the pediatrician or the family physician.
Okay, doctor. And doctor, what are the complications of having recurrent coughs and breathlessness?
So recurrent cough and breathlessness per se make the child uncomfortable, disturb sleep, disturb the feeding. In older children, may disturb studies. But we need to worry more about what is causing the recurrent cough, because the reason underlying or the disease underlying is a more worry for the pediatricians and for the parents. Whether it's the immunological disorder, whether it's some allergic problem which is not getting better, whether it's some cardiac ailment, what is it? And unless and until we find out and correct that cause, if correctable obviously, then it's going to affect the health of the child. Remember, in allergic cough or in asthma, if we do not identify the problem earlier and we allow it to happen over years, over months, it can make some irreversible changes in the lung. At that stage, if we pick up and we try to treat, the child may not respond to the simple treatment.
Okay, doctor. So, doctor, as you have earlier mentioned the causes of recurrent cough. So, here the question is how to diagnose causes of recurrent cough.
So, for a diagnosis of recurrent cough, the children with recurrent cough, for any ailment in medicine, there are three major pillars to reach a diagnosis: the history or the symptoms as mentioned by the parents of the child, the examination finding, and then investigations. So, based on the history from the parents, based on the clinician's clinical finding when he examined the child, the clinician or a pediatrician decides the investigation to be done. And the combination of all three helps the clinician to reach the diagnosis. There is a possibility at times that the clinician is unable to reach the final diagnosis but may be able to pick up the basic problem behind the cough, like allergy, then he directs the treatment towards the cause. This is how a chronic cough or a recurrent cough is diagnosed or managed.
Okay, doctor. And doctor, what treatments are available for recurrent cough and breathlessness in children?
So there are a lot of medicines available in the market, and unfortunately in our country everything is available over the counter. It's my appeal to the parents that not to go to the chemist and ask for a cough syrup, because if it was so easy to prescribe the correct medicine for recurrent cough, there was no need for a pediatrician to study for 10 years. As I've already said it, that there is an age group where cough suppression should not be used. There is an age where bronchodilator are more useful. So let the pediatrician decide what is the most appropriate medicine for use. In a session like this, giving an information about a possible treatment of different causes of the cough, I would say will cause more harm than any benefit to the society.
And doctor, which is a good antibiotic for recurrent cough?
Okay, good question. Antibiotic is not a solution to everything, and every cough is not a bacterial cough. We all understand that antibiotics are for bacterial infection. And if we go through the list mentioned earlier in this session about various causes of recurrent cough, you will realize that most of them were within the respiratory system, were allergic, were congestion, were viral infection, and outside the respiratory tract were some structural problems, whether reflux or a heart ailment. And in all these conditions, antibiotics have no role. And therefore, under pressure, writing an antibiotic is not a very healthy practice in children who are suffering with a recurrent cough.
And doctor, what immunity booster should be given to child who has recurrent cough?
Again, it's my humble request that peer pressure leads to this kind of a question. That somebody is giving some medicine, some multivitamin for boosting up the immunity and is helping in the chronic or recurrent cough. Let me say, all these medicines available in the market do not have any role in children who are having a recurrent cough. If at all there is anything that we need to look into, it is the vitamin D level, and that is also is not very widely accepted theory, but yes, I feel there is a definite role of vitamin D supplement in those children who are deficient in vitamin D, not in those who are having normal vitamin D level. Those children who have a deficiency of vitamin D may suffer with respiratory ailment. Quite often, if we correct the deficiency, they do better in their life.
Okay, doctor. And doctor, when should parents take their child to doctor?
Every child who is having recurrent cough should be taken to the pediatrician, at least till the time the diagnosis is established. Once a diagnosis is established and the pediatrician has given a clear treatment protocol, then in case of minor attacks or mild or moderate cough at home, the mother or father can give the earliest prescribed medicine to some limited time, and if the child is not getting better, this is the time again to go back to the same pediatrician or any other pediatrician.
How can parents know if their child's cough is serious?
Very important for the parents to know when there is no way that they should wait at home. So any cough, first episode or recurrent, if the child is breathing very fast, if the child has high grade fever, if the child's feeding has gone down significantly, if the child is unable to sleep, is the time that you consider that the child's cough is serious enough to visit the nearest possible hospital.
Well, doctor, that was really a great response. And our last question of the show will be any message that you would like to share with our viewers.
Okay. So recurrent cough, I would say, is one of the most common reason for the visits of children to the pediatrician's outdoor patient department, and it is very important for us to understand that in recurrent cough, if you haven't visited a pediatrician yet, please do visit a pediatrician. Let him assess your child, let him reach a diagnosis, let him give you a protocol for the management from this point onwards, and thereafter only in serious conditions, only non-resolving long attacks, you can go back to the doctor, or you may try those medicines which are already prescribed by the pediatrician for a limited period of time. Please do not start on antibiotic right in the beginning every time. Please do not believe in giving multivitamins. Please do not give cough suppressant to small children. Remember, all these are very important and very useful points in the management of recurrent cough in children.
Well, doctor, that was really a great response again, and it means really a lot to us to be with you in Marika Talk Show. And thank you so much for your precious time.
Thank you.
So we will see you in another next session with another exciting topic. Till then, stay tuned, stay happy, and stay healthy.